Good morning, quarantine. All right, this time we're gonna go through cars again, a little bit faster, a little bit different, and then we're gonna work specifically on hips in terms of mobility, and then we're gonna do some lower body exercises. Pretty quick, straight to the point. All right, so let's go ahead and do the cars again. Look, as before, we're gonna start with our neck. You're gonna have a little bit of brace here. Hands, good, make a brace, good. Chin down, rotate across the collarbone as far as you can here. Try not to move your shoulders, shrugging or anything like that. Lean back, trace your chin across the sky, other side of the collarbone, back here. You want to do 3 of those rotations per direction. Rotate around, good. Once again, you're watching out for those closing angle joint pain or closing angle joint restrictions. That will be, if you're going this way, there's gonna be a little bit of pinch, a little bit of hurt, kind of skip that part. If it's just a stretch over here, totally fine. This is the 3rd one. You may already have been going at it and are done. Just wait for us or do a few more. Go around this side, all the way around. 1. Remember, I am not translating my neck, I am rotating in place. 2nd rotation here. 3rd one right now. Good, there we go. All right, scap, here we go. We're gonna this time hold it instead of here, we're gonna hold it around in front of us 30 degrees, not completely straight, a little bit like this. Once again, we're just gonna do 2 directions for now. Protraction, retraction, just to kind of get used to that. Make sure you're not using your body to move, just your scapula. Good. Scapula has to work really well for shoulder stuff. It has to glide around smoothly against the other tissues and structures. Okay, now elevation and depression. Good. Watch my fists. See how they're still pointing to the same thing. Good. Now we're going to do all 4 directions. Protraction, elevation, retraction, depression. Up, back, down, forward, slowly and surely. We're trying to do controlled articular rotations. Good. Reverse that direction. Up, forward, down, back, up, forward, down, back. There we go for your scap. That's pretty complicated, and for some of you there'll be a little bit of movements, a little bit of compensations. Watch out for that, which is why as we do this over time, we're going to try different positions, we're going to try different blocks, and you'll find out what that is in the future. All right, shoulder, here we go. Shoulder's pretty tough, so what I want you to do is find a wall and just kind of stick your body there. See that? I'm holding on to this. Good. I'm sticking my side here. My foot is against the wall. This way I can really focus on just rotating my arm. If I'm turning around, you can feel that, and that's how you know you're feeling the compensation. Good. Up, internally rotate right here. Remember that marker on the bicep? It's now rotating down. Come back to the side, rotating up. Good. Remember, it's not about trying to get as big of a circle as you can. It's just about trying to get that big circle, but whatever you can do, not necessarily what you think you can do. Good. 1 more. Remember, cut across the center. Up into flexion. Internal rotation, down. Go back into extension until you're stuck. That's your point that you can now externally rotate. Go up into flexion and then down, crossing the middle, which is called adduction. I'm going to use some technical terms, but you are going to get it, know what they mean in due time, and it's just really good to use that kind of language because it helps explain with direct specificity. All right. Other side. Watch that position here. Braced against the wall, hips against the wall, left leg this time against the wall, going across, up, internally rotating that bicep, the whole arm. Good. All right, again, into flexion. I'm saying good to myself. It is good. I'm doing good. And back. Externally rotate. Cut across. This has really helped me get my shoulder in better shape after a lot of abuse through tennis and volleyball and other racket sports. And over. Good. So next we got the spine. This time I want you to use that same wall, since that seems to be the theme today. Got a nice little wall here. I'm now going to put my heels a little bit forward, like 8 inches, but I'm going to have my butt against the wall here, my hips. All right, give myself a hug. I'm going to go into flexion. I want you to roll down slowly. Feel your spine rolling down the wall. Good. Good, especially the lumbar right here. Right here, you should feel your lower back against the wall. Good, keep pushing, keep pushing. Good, keep rolling in as much as you can. Rolling in. Good. Don't have your lower back leave the wall though. So that would be, I want you to just focus on getting that lower back there. You could leave a little bit. Good. All right, now rotate. Good. Rotate to the other side. Bam. Rotate again. Good. Lean to the side. Now you can't really go into extension because the wall is blocking. That's okay. Just go like this. Go as far back as you can, even though the wall's there. Land here. Rotate the other side. Good. Lean to the side after the rotation. Good. Rotate in. Last one. Excuse my sniffles. It is allergy season and it is upon us. Turn in. Here. Reverse. Turn. Lean back. Up. Good. Alright. Here. Again. Lateral flexion. Kind of an extension because the wall's blocking. And here. Good. So we've done that half. Now we're going to do the other half. So now I'm going to put my toes touching or pretty close to the wall. Now I'm going to have my hips touching the wall too. Same hug. Now I'm in extension already. Now, if this hurts your back, you can adjust. You don't have to force yourself into that painful position. You can back off a little bit if you want. If you can though, go forward. And now you're in extension. Now while in extension, really try to push that chest towards this angle, towards the wall, but also up. Because you don't want to focus all that bend in your one spot in your lumbar. And that'll be called a hinge point. And some people have that. And that's okay. We can work on that later. But for now, try to feel like everything is bending, not just this spot, but also here, especially right around here. You want that to be in extension. See? So now I'm purposely lifting my chest up. Yep. And now you can rotate to the side. Good. Try to get the elbows clear of the wall. Good. So we're basically breaking down the spine car into 2 parts here. Flexion and extension. This is the extension part. Good. All right, you got that? So now why we did that is so that when you do the full car by yourself like this without any wall, you now have a better feeling of what it's supposed to be like. You know, and you've noticed the compensations too more easily when you have something blocking you. All right, what do we got next? We got the hips. All right, actually we have the wrist. Let's do the wrist real quick. As you remember, keeping the wrists up. Go into rotation. We're going to do together at the same time. Good. Yep. Try not to turn the wrist. Again, you can put a phone here or something balancing here just so you can feel what it's like, and it'll catch yourself from like turning your forearm, which is very, very common. Happens to everyone. unless they've, practiced this. Slow, controlled articulations. Good. Yep. Here we go. Here we go. All right, elbows. Remember what we did last time. Fully flex as much as you can. Show me your wrists, hide your wrists. Just like that. See how it goes to the side a little bit? Totally natural. Good. Right there. Bam. Good. Now, fully extended. Keep the elbow pits facing the front. Turn them in. Your forearms, turn them out. Turn them in, turn them out. In and out. Good. All right, now hips. Hips, second most mobile joint. We're going to use the wall this time, is our theme, to help us feel the hip cars more. All right, here we go. So I got this. Touching that, I'm going to brace right here. Remember, you're going to go into flexion, but also external rotation. So it's not just here. You're going to go here and out here and bring that as far as you can. I call it the hacky sack. Hacky sack up, bring it to the side, and internally rotate. Catch up in the bottom. Coming back up, coming out to the side here, and hacky sack down. Number 2, up, here, rotate, good. Come back, good. Watch the angle of my knee. It doesn't really change. It stays at 90. Just take a note of what yours is doing. Good. Come back out to the side. That's abduction, external rotation right there. Back down. Good. Switching sides. Here we go. Good. You also get a different angle here. There we go. I'm going to brace, take it out here. There we go. Up again. Flexion, abduction, internal rotation, pass, extension, reverse, extension, abduction, external rotation, go, go. Good. Now, external, internal rotation is all about what the main structure is doing. So here, the femur, thigh bone, is turning outwards. So that's external rotation. If it's turning inwards, internal rotation. Okay, same thing with what we did with the shoulder. This time we're looking at the humerus for that one. Internal rotation is turning in, external rotation is turning out. Okay, next, ankle. Since we're using our handy dandy wall, right here, just hold your leg. Ankle super slow, full rotation. Good, nice and slow. Make sure you get those corners. I like to call it scraping the jar. Yeah, peanut butter, strawberry jam, raspberry jam.
Move away from the jams.
What?
Whatever kind of jar you like to scrape. Sauerkraut. I like sauerkraut. Ice cream, I guess. They don't really come in jars. Maybe the fancy ones. I don't know. All right, next. That's 3 rotations in each side. Rotate. Rotate slowly. Good. Reverse. Bam. 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 I don't know why I'm saying bam. It's like I'm cooking. Like Emerald Lagasse. All right. Get it again. Now we're going to do the knee. Remember that tibial rotation we did last time? That's the shin turning in relative to the femur. All right, feel that. First, point your toe up, dorsiflex. Turn to the right, turn to the left. I'm feeling that shin bone here, seeing if it's moving under the skin. If it's not moving, that's okay. Keep trying. Eventually it will. Took me I don't know, a week, a couple weeks. I didn't even thought it was possible before. Lo and behold, the knee rotates. Good, good. Yes. Bam, bam, Bam. Now, a full knee car, just like the elbow car, we're gonna do that soon, but it kind of looks like this. Here, turn to the outside, external rotation, flex the knee, turn to the inside, extend the knee. So that's the rotation. That's pretty hard to do until you know that you can actually rotate your knee. Anyway, so those are the cars. Very important, very foundational. It is basically what will enable us to move our joints in all the ways possible before we even do anything in the rest of the day. So if you do this first thing in the morning, which you should be doing now, that's it. You've moved your body in all the ways you can. Then the rest of the day, you're really just putting together bits of those movement, right? In order to accomplish a task. But we must make sure that each action is independently excellent before we dependently have it work with another action or with another part of your body. As we like to say in the FRS community, it is independence before interdependence, talking about joint function. All right, so today we're gonna focus on the hips. There's a lot to do with the hips, so we're just gonna do one part of the hips because we're gonna do some squats, back lunges, Cossack squats, and that will be your lower body workout today. Okay, so let's get down. Okay, we're gonna use the wall, which is a very useful tool. Okay, so I want you to just see what the wall feels like. When you're sitting in this position, can you put your whole back against the wall? Or is it uncomfortable? Do you have to lean forward, hunch a little bit? I used to. This one feels pretty good. You feel like your spine is straighter, but you just really go into extension. That's okay. It's good. Okay, here, most people say they have tight hamstrings. And really, people are like, well, maybe it's too tight, or maybe it's actually too weak. You know, that's why it's tight. One thing for sure is that the less you use it, it's definitely going to have more problems that way. The best thing to do, like most of this stuff, because our body works as a whole, all together, at the same time, all the time, is to move it and work at it. Okay? So if your hamstrings are tight, then this is already gonna feel like a stretch for you. If not, you can reach forward like that until you feel that stretch. When you feel that stretch, I want you to then straighten your back. Whoop, there we go. Even more of a stretch, right? Now, since we're focusing on the hamstring, and if you feel the stretch solely on the back of your knee, I want you to bend your knees a little bit, just a tad, just to get that stretch out from the back of your knee and into your hamstrings. So I'm gonna reach forward. There we go, straighten my back. That means pushing your stomach this way, everything coming out like this, chest out, right there. You should feel the stretch. Remember, if you feel it only in the back of your knee, then bend your knees a little bit. That will transfer the stretch to the hamstrings. We're gonna hold it for 2 minutes. So instead of really just playing out the 2 minutes here, why don't you guys press the pause button and hold it for 2 minutes.
Totally.
Okay, you've held it for 2 minutes. What do we do now? Okay, now I want you guys to drive your heels into the floor or mat, whatever you're on, carpet. Drive it in. It's kind of not that easy to do, but I want you to try and drive it in. Even if you feel like, I'm not really producing much force here, just try. We'll slowly start to create force there, even if it's just an ounce. That's totally cool. Good. Now, I want you to try and lift your heels up. Now, obviously, it's not going to move much. It may not even move at all, but just trying to do that will really help. That's the whole point. Intention matters here. What you're trying to do, even if it looks like there's absolutely nothing happening, in the physical, there is actually a lot of things happening on the inside of your joints. physically too. You just can't see it because it's happening in that small of a scale. So try to lift the heels. Good. Drive it down again. Drive it down the floor. Drive it down the floor. 5, 4, 3, 2, 1. Try to lift it. Try to lift it. Yep, looks like nothing's happening and you're straining. That's totally cool. People always look at me weird when I'm doing this in the gym. They're like, he's not really doing much, but he sure is struggling. Well, a lot is happening, folks. Drive it down. Last time. 5, 4, 3, 2, 1. Try to lift. Try to lift. Try to lift. There we go. 5, 4, 3, 2, 1. Good. Okay, now move your arms a little bit farther. Check 2 inches. And then straighten your chest again. Yeah. You should be able to have gained a little bit of range there. But now you're stretched again, which is totally fine. Good. And drag back. Good. So that was a little bit of pails and rails. I will explain more of what that is in the next episode. But for now, that's what you did. And we've just kind of gained a little bit of range for our hamstrings there, for hip flexion, really. Next. Okay. Little bit of external rotation and an internal rotation. So I'm going to sit down like this. Straight leg here, 90 degrees here. I'm facing where the knee's facing. 90 degrees right here. Straight leg here. And I'm going to go in my elbow. Because for you guys, some of you guys, this might be totally fine and you totally have this position.
Totally.
But for some, this is not comfortable. Maybe it's getting a little pinch here or here. So what you want to do is just kind of lean back a little bit or lean to the side. Make it a little bit easier. All right, so now what we're going to do is push this knee down and try to lift up the ankle of my right leg here. Lift, lift, lift. Now, I've been working at this, so I can do it a little bit. Some people can go super high. And then, whatever you got, just lower it down slowly. There we go. And now try to drive that heel or that ankle into the mat again. But try to keep this guy from rising up. So you're really just pushing your whole leg down. 5, 4, 3, 2, 1. Try to lift the ankle again. There we go. 4, 3, 2, 1. Good. Drive it down again to the mat, the whole leg. 4, 3, 2, 1. Lift. There we go. I'm gonna grab it now. Lift it up. Try to keep the knee down here. This is called a passive range hold. So passively I can yank my leg up here. Be careful, of course. And then I'm going to try to hold that. I'm going to let it go. Okay? Check this out. 5, 4, 3, 2, 1. Let go. Brace. Hold it up. Hold it up. Shaking is totally normal. Yep. It's pretty hard. Try to keep that knee down and land softly, softly, softly. Parachute down. Good. 2 more. Pull that ankle up. Brace. Hold. Hold it up. 5, 4, 3, 2, 1. Parachute down. This should be hard. If it's not hard, then you can take your leg up higher if you can. Because you want to go to your passive range. That was just the end of my passive range. Okay. Here you go. Hold it up. Brace. Hold your knee up. Push the knee down. Hold your leg up. Push the knee down. 4, 3, 2, 1. And land softly. Whew. There we go. Switch to the other side. Whoop. All right. Same thing. You're going to lean back. Push this down. Drive the whole leg down. 5, 4, 3, 2, 1. Lift the ankle. 5, 4, 3, 2, 1. Lower slowly. Drive down. 5, 4, 3, 2, 1. Lift the ankle. 5, 4, 3, 2, 1. Lower it slowly. Drive it again. 3, 2, 1. Lift the ankle. 5, 4, 3, 2, 1. Good. Now, passive range hold. Pick this up. Hold it up as high as I can while keeping the knee down. Brace yourself and hold. 5, 4, 3, 2, 1. Parachute down. Lift the ankle. Brace. Hold. 5, 4, 3, 2, 1. Parachute down. Lift the ankle. Last time. Brace. Hold. 5, 4, 3, 2, 1. Parachute down. Good. All right. We're going to cover internal rotation in the next one. But for now, we're going to go to our exercises. Squats. Okay, squats are pretty complicated. There's a lot of things that go into it, right? So what could be limiting your squat could be anything from ankle mobility, hip mobility, even spinal mobility. Because as you can see, there's so many parts that goes into squat. So to get this low, my ankle has to be able to go this far. My spine has to be able to go into extension, otherwise it'll fall over. And then my hips here have to have enough rotation and also flexion to be able to accommodate this position. So a good way to start is to have something that you're fairly comfortable getting up from, kind of like this. This is an 18-inch box, kind of like your dining room chair, or some of you guys have, I don't know what kind of chair, something, but something this height or even lower. We're gonna try different ones. So for those who can squat all the way without any pain, without any limitations, and it kind of looks pretty good, it feels good, you're not hurting your knees like that, but you feel the work going on in your hips and in your thighs, in your butt. Okay, here's the program. You're gonna do 20 pretty fast, like that kind of speed. Now for those of you who can't get that low, start with this is 18-inch box and go from there. This is a good chance for you to really focus on what your upper body's doing. Straight up, straight down, like that. See that? Now from the side, it's really still a hinge. Hinging forward, squeezing my hips to the front. Bam. Bam, good. Do 20 of those too. Now for those of you who are pretty fit and you've done a lot of squats, then this is the time to hold some weight in front here. Like this. Hold it close to your chest. Not so far because then your shoulders will be doing work. You just want to focus on your squats here. So hold it close to your body. You can even use a shorter box. This is a 12-inch box, kind of like a step stool. Some of you will have that. If not, even like just a small box that's sturdy enough to hold your weight. Try it from here. Good. And this can be your progression. And start here 1 week, here the next week, if everything's feeling good and you're doing well. And then eventually, you're gonna go through the final progression, which is just total air squats. All right, the program was 20 squats and you're gonna do 3 sets. Hit the pause button now and unpause when you've done 3 sets of 20. Go. All right, you've done 3 sets of 20. That could be pretty easy, pretty challenging for some of you, but it's a good enough volume for our squats to start off with. Next, you can easily turn, since you already have a chair, into a step up. Step, lift the knee. I like to lift the knee because it gives a chance for this leg that's working to go into full extension. I'm gonna do it this way so you can see. You can really step all the way up. Yeah. Be safe. You can use keep something like a wall, you know, if you have trouble balancing. And then if you have a higher box for even more of a challenge, go with that. Bam. Good. If you don't have a box because you were doing air squats all along, I want you to do a back lunge here, like that. Bam. Bam. Good. All right. reps and sets for that. I want you to do 15, 3 sets again. So that's 15 each leg, do 15, and then go to 15 other leg and rest for about 10 to 15 seconds, and then go again. Second set, 15, 15, rest. Third set, 15, 15, rest. Hit the pause button, unpause when you're done. Okay, next is the Cossack squat. Cossack squat is pretty complicated, and it's all relative, but it can be easy for some, it can be pretty tough for some. It looks like this. So I'm laterally lunging to the side. Good. I'm keeping my chest forward, I'm squared, my upper body. I'm not twisting here. And as you can see, I don't end up past my knee. I'm still within the space between my legs here. All right, so what you want to do here is stay upright, right? You're gonna push your hips back like that. A lot of you, this is gonna kind of happen. Try to lean back, keep your eyes and chest forward. If this is all you got, then it's all you got. Totally fine. We're just trying to do this safely and start working this angle. Now, at any time you feel like, that hurts my knees, please, you don't have to force it. If it's like more than a level 3 pain, just stop and go back to do one more sets and reps of the other 2 exercises. Totally fine. And if you really want to pursue that and see what's up and how I can help, then hit me up. Ask me a question online, email me, totally answer to help you, and maybe even have a one-on-one session if you're so inclined to really like work on that. Okay, so progressions. You already have your chair or your structure that you used before. You can use that too to help you. Here, I'm using a 12-inch box as like a landing point. Do try to keep this other leg straight. Good. This is the 18-inch box. Using that as a guide. It's not as low as the other one or the Air Pure Cossack, but that's cool. We're all working with our capabilities here. Okay, for this one, I want you to do 10. 10 on each side. Knock it out. 10 here. Good. Rest. That's the one set. Rest 10 to 15 seconds. Do it again. 15 seconds. Do it a third time. 3 sets. All right. Pause now and unpause when you've done it. All right. This is for our final exercise. We're going to do some glute bridges. So if you already have that structure you're working with, that box, go ahead and use that. I think 24 inches might be too high. You can go with something lower like this. This is 12 inches or like your step stool, or you can really just use a coffee table. Make sure it's clean and make sure your feet are clean, and or your couch, something like that. I'm going to use the floor too. I'm going to have my feet here, hands down. Just try to relax your hands. Don't try to push yourself with it, and you're just lifting your hips up. Good. Now here, you want to make sure that you're not like arching your back too much. See, that's mostly back. What I want to do is like create tension in my core like that. I'm going to keep it slightly tucked so my lower back is tucked right now. So my lower back is touching the floor. If it's already lifted like this and fully arched, and then you do that, it's not going to feel good on your back, and it's not really going to work your glutes and hamstrings the same way. So I want you to first pull down your core like that. So your lower back is now touching the floor. With your lower back touching the floor, you're now in the right position to lift your hips. Good. It's not going to be super high or anything, because the whole point is just to take your hips into extension like that. See? It's extension right here because it's a straight line. And as you push your heels down, you feel your glutes engaged and also your hamstrings. By the way, it's more like feeling your glutes and hamstrings, working the most. the whole engaged, not engaged thing is really kind of a misnomer. It's they're always engaged. They're working. If you can stand up, they're always engaged. It's not like your muscles can get turned off or on, you know. So sets and reps for that. I want you to do 20, rest, and then I want you to do 30, rest, and then I want you to do 50. The 51, I want you to do kind of fast, faster than usual. So if you did this speed for the first 2 sets, for the 50 in the end, I want you to go 1, 2, 3, 4, 5, like that speed. Once again, maintaining the same integrity in your lower back there. So we're gonna be focused on using the posterior chain of our lower body and not so much our spine. And that's about it. So I'll see you guys next time. Stay tuned and feel free to message me. Keep in contact, communicate. It's all good. I'd love to hear from you guys. Take care. See you.